because it seems then that what's happened here is that the psychiatry industry or the pharmaceutical industry, what they've done is they've taken normal, natural human behavior and responses to life. And yes, some of them are painful experiences, but that is part of life, right? So we've taken those normal human characteristics and we've said, no, these are actual diseases of the mind, or, and you need to be treated for them. That's essentially what's happened, right?
Yeah, that's the only way you go from what used to be maybe a sense that 1 or 2% of the population suffered from a mental illness to 25%. You're medicalizing normal, right? So to speak. And the only way to look at this is why did this happen is through a capitalistic lens. Because although it's been a disaster for societies, the burden of mental illness goes up everywhere you adopt this disease model. Who's benefited? Well, in 1987, which is the year Prozac comes to market, we in the United States spent about $800 million on psychiatric drugs. 20 years later, we were spending $40 billion. So that's a 50-fold increase in market size. Now, what do capitalist countries want to do? Capitalist, companies, they want to create markets. They want to expand their markets. And right from the beginning, the market for, quote, serious mental illness, what we used to know, was quite small. So we need to sort of see kids in this. We need to lop off a section of the kid population. And then we need to lop off a section of the normal functioning population. And that's what they did. And how did they do that? They paid psychiatrists at academic centers lots of money to help build these markets. And once you view this story through that financial lens, you can see how in a capitalistic society it worked. Capitalistic societies are about building markets. That's what pharmaceutical companies want to do. And by the way, the great thing about psychiatric drugs in this story was you were creating patients for life. Drug companies don't want drugs really that cure something acutely, because then someone's taking the drug for a month. But man, if they can take someone and make a regular user, no, this is a much better business model. And it even becomes better because this is going to sound cynic, but we know this is what happens. So often the first drug causes side effects, right? Or doesn't really work. Well, they don't take that drug away. They add a drug. And if that doesn't work, pretty soon people are on 4 drugs. Well, think about that. You took someone who was on no drugs, and next thing you know, they're taking 4 drugs, and they're doing so on end. That is a great business model. And the way they did it was paying people with prestige in American society, that's psychiatrists at academic medical schools, to be their key opinion leaders. So they would be the ones that would write the textbooks, they would give the continuing education classes, that sort of thing. And they were, amply and rewarded for building those markets. Now, that's a betrayal of their duty as a doctor, but what you see is hundreds of thousands and even millions of dollars being paid to the doctors that served as key opinion leaders. And last thing on this, by the end of the 1990s in the United States, virtually every academic psychiatrist in the United States had ties to the pharmaceutical companies. In essence, what we say is the pharmaceutical industry had captured psychiatry as a profession.
Yeah, because I remember I was looking into all of this, and so when DSM-5 came out, I believe it was number 1 on Amazon's top selling books or something. It was
right. It's not cheap either.
Exactly, it's like $85. So it can't be the public who are buying this.
No, what that tells you is how therapized our society has become, because there's a whole therapeutic industry out there now. And because we've had people think about this way, we've had an explosion of counselors and, all that sort of thing. And if you're getting insurance reimbursement for whoever you're treating, generally in the United States at least, you got to give them a diagnosis. So they all need the DSM. And of course, I don't know exactly what happened with DSM-5, but typically what the pharmaceutical companies would do is they would buy a lot of these copies and then hand them out to prescribers and therapists and that sort of thing. Think of it as a marketing manual.
Yeah, literally, it is just a marketing manual. But it's, there are so many questions in relation to let's go back a little bit further. So, who is responsible? I suppose that's a question that you can't probably give an answer to. But who is responsible for this? Is there somebody that we could say, okay, this is your problem, this is your fault? Does that exist?
I think there is. Well, I think it's clear. Now, people like to blame the pharmaceutical companies. I actually don't. Even though the pharmaceutical companies, as they would conduct trials, and they'll conduct trials to make the drugs look good. There's all sorts of ways you design your trials to make your drug look good and hide adverse effects, et cetera. And then the way, they control the publication of them and that sort of thing, and they would spin the data and all that story. So the pharmaceutical companies, which are motivated to make money, they're not in the business of healthcare. They're in the business of making money. And so, of course, they played the system to, create this market. I don't think we as a society put our faith in pharmaceutical companies. Who do we put our faith in? And who do we say, you have the responsibility of being honest with us and taking good care of our health? And that means being honest about science. Who do we do? The medical profession, right? So the problem is psychiatry got bought. And it allowed itself to be bought because it also fit its own trade impulses. They wanted to present themselves as doctors. They wanted to present themselves as doctors with effective drugs. So it fit with a way to elevate their prestige and their status and power in society. So those two impulses came together: the financial influences of the pharmaceutical company or demands, and the trade influences, on psychiatry as a trade, and also money given to the American Psychiatric Association by pharmaceutical companies and money given to the psychiatrists. But who's to blame? It's the academic psychiatric community that has a responsibility to inform the public of what is really known about these things, about these disorders, whatever you want to call them. And it has a responsibility to tell us about what is the short-term effectiveness. It has a responsibility to tell us what are the long-term outcomes and what are these drugs doing to your brain. That's their responsibility. We put our faith and trust in the medical discipline. And psychiatry as an institution has betrayed that obligation, that trust we put in. And, I co-wrote a book with Lisa Cosgrove called Psychiatry Under the Influence. And we wrote that book while we were fellows at the Safra Center for Ethics at Harvard University, which was set up to study institutional corruption. How do institutions that have a public duty stray from that duty, betray that duty, and serve their own interests rather than their public obligations? And we wrote a book about how that happened with psychiatry. But that's what's happened, and that's who's to blame.